Hi, everyone. My patients often ask me if I can let them know what are some choices they can make in their lives to help prevent their cancer from coming back or to help their cancer from progressing. And so I decided to make this video series for all of my patients. I'm Dr. Rekha Chaudhary, and I'm a medical oncologist at the University of Cincinnati Hospitals with a specialty in melanoma and primary brain tumors. So when you're diagnosed with a cancer, it's very stressful. And it's also stressful for physicians. And so my journey has been, I started doing this many years ago, and I started to become very anxious because I was seeing patients who had never done anything wrong in their life, and all of a sudden they were developing cancers. And my husband is like, you need to get out of this field. And then I saw Forks Over Knives. If you haven't seen that movie, I would take a look at it. And it was the first time that I thought, and you can make choices, healthy choices to prevent cancer. I had never been taught this in medical school or anywhere else, okay? In medical school, residency, fellowship, all of my years of training, I'd never been taught this. And I was intrigued by this and started reading about it. That was what got me interested in the field of integrative oncology. So it used to be called alternative medicine, okay, because we were like having these healthy choices over here and then traditional medicine over here. But now we call it integrative oncology because I believe in radiation. I believe that chemotherapy works. I believe that immunotherapy works. I believe surgery works. But I also believe that making some choices in your life to better your life and better your cancer outcomes works. And that's why it's called integrative oncology. You may have never heard of this field, but why don't we have a field of integrative cardiology? Well, because the cardiologists have done a great job in the 80s of educating patients that if you exercise, manage your stress, and eat well, your risk of cardiovascular disease goes down. So we all understand this, right? We all understand that if I eat a steak every day, I'm at risk of having more heart attacks. And we can envision that, the fat in the cardiovascular vessels. Why is there no integrative care of the diabetic patient? That's because we already know that. We already understand that if we eat right and eat low sugar, that our chance of getting diabetes goes down. So hence the field of integrative oncology is not as intuitive, right? It's not as intuitive if what I eat here is going to affect my breast cancer, or what I exercise is going to affect my cervical cancer, or if I manage my stress, my prostate cancer may not come back. This is not intuitive, and that's why it's important and interesting to think about. Okay, why incorporate integrative oncology into your life? Yes, it'll make you feel better. A lot of people want to do this because they want to tolerate the chemotherapy better or feel good while getting surgery or radiation therapy. And it will do all those things. But that's not what this talk about is today. This talk today is about how it works, okay? Duty calls. So where were we at? We were saying that there are billions of dollars spent on pharmaceutical companies, but there's not much money spent on meditation or yoga or diet choices or broccoli, for instance. There's also a non-acceptance and fear from physicians. And why is this? Because physicians have a fear that patients are just going to eat broccoli for the rest of their life and not get their cancer treatment. And that's not true. And we know that from a patient perspective, that patients are not going to do that. But that's the fear. And interventions are often subjective, and that's why physicians are scared. For instance, golf really is very stressful for me. It's a very stressful sport. For my husband, it is his form of relaxation. So how do we conduct studies on stress when different things stress different people out? And there's a lack of large standardized studies. And what do I mean by that? So this is, we love in oncology the prospective, randomized, double-blinded, placebo-controlled trials. That's what we love. And what is that? That's where you take a patient and you randomly assign them to drug A or drug B, and then you follow them and you find out what happens to their cancer or their cardiovascular disease or their diabetes, okay? And we love this, and we love people to be blinded to the outcomes, and that's where we have blinded trials. And that's where that comes from. And then we get these nice, beautiful curves. And we have to talk about this because we have to go a little sciencey because in the interest of this talk. So when we look at these curves, you can see the surgery line is on top in this particular curve, and chemotherapy, palliative care, radiation therapy, they're all on bottom. So in this particular trial, surgery was better than all of those, and we like to look at the difference between the survival. And we want to make sure it's statistically significant. So it has a p-value of less than 0.05. So you got to memorize that because there'll be a quiz on that later because we're going to look at some trials. The other thing that we want is we want it to be published in premier peer-reviewed journals. And so these are three of the premier scientific journals: Cell, Science, and Nature, which I'm going to be quoting from. And from now on, everything I talk about, at the bottom of my screen, you will see a reference for it. And you can actually read the scientific study if you choose. And I try to use journals. Any study that I show you, I try to use journals that are very scientifically rigorous and peer-reviewed and accepted. Okay? And the other way that we can look at integrative oncology, because we obviously can't do these randomized trials. I can't randomize me to golf, 50,000 people to golf and 50,000 people to no golf and see what happens, right? We can't do that. So one way to look at it in a rigorous manner is to look at animal models or look at our tissue underneath the microscope. So first we're going to talk about stress. Now, does stress cause cancer? Again, there's no way to do that. We can't stress out the mice for many, many years and see if they get cancer, and stress out the other mice for many, many years and see if they don't get cancer. Unstress them and see if they do not get cancer. But we do know that stress causes cancer progression. And this is a validated method for looking at stress in mice. We know that this method stresses out mice. Their epinephrine goes up, their cortisol goes up. And they can't get turned around, as you can see in the picture. They're stuck in that thing. And if anybody's had rodents as pets, you know they love to be free and running around their cage. Well, they injected their stomachs with breast cancer cells or ovarian cancer cells. And what they found, the control group, who was not stressed out, had hardly any growth of their breast cancer cell. However, when they did a CT scan on the daily stressed out mice, they actually had very, very large increase in their cancer cells. They initially started stressing them out 6 hours a day, but then they found they only had to stress them out 2 hours a day to really get these results. So I don't know how many of you have stressed 2 hours a day, but you can imagine these poor stressed out mice grew their cancer cells, and a picture's worth 1,000 words, because you can see the amount of growth. So there's no doubt, multiple repeat studies of this, that stress causes cancer progression. And in another series, I'm going to go over how we can manage our stress and validated methods that have shown to decrease cancer decrease our cancer. What about exercise? So again, a similar experiment. Mice were placed in a cage with a wheel. Half the mice had a wheel, half the mice did not have a wheel. And again, if you've had rodents as pets, you know they love that wheel. They love the wheel running around. They injected their bellies with melanoma cells this time. And you can see on the left set of pictures is the control group. They did not have a wheel, and the melanoma grew. All those dark spots are melanoma. On the experimental arm, the ones that did have a wheel, the melanoma did not grow at all. Now, how could this be? Well, if I've talked to you in clinic, you know about natural killer cells or T cells that are fighting cancer. And this is an electron microscope picture of natural killer cells attacking a breast cancer cell, and it's called the kiss of death. This is actually a photograph that has been colored. Okay, so as you can see, the T cells are attacking the breast cancer cell. So what they did is in this experiment is then they created natural killer cell knockout mice. So the mice did not have any natural killer cells of their own, and then it didn't matter if they had a wheel or not. So by proof of principle, the wheel was what, or the exercise was what helped the melanoma go away. And you can see here, this is in the natural killer cell knockout mice. It didn't, the tumor ball growth was the same, exact same in both arms, whether they had a wheel or not. So that is one mechanism, scientific mechanism, by which exercise helps. This has been shown in athletes. They've checked natural killer cell activity before and after exercising for 30 minutes. And so we know that exercise is a great form of activating those natural killer cells. What about sleep? Well, it's interesting. I had the fortune of meeting Elizabeth Blackburn. She's a Nobel Prize winner in physiology and medicine in 2009. And she won the physiology Nobel Prize in 2009. I met her later, but she's one of only 11 women, excuse me, to win the Nobel Prize in physiology. So it was a great honor. And her work is on telomere length. So these are pictures of our chromosomes, and it's like the caps on our shoelaces. And telomere lengths shortening is associated with cancer risk and premature death. So you want to have long telomeres, long caps to keep your chromosomes healthy. And they did an interesting experiment. 250 interns in medical, doctor interns in 55 institutions. And they measured their telomere lengths before and after their intern year. And actually, if they worked 75 hours or more, they had really, really huge shortening of their telomere lengths. So you can see this going down. This is how shortened they are. So they were getting a lot of lack of sleep, a lot of stress. But on average, their telomere attrition rate was 6 times greater than the typical attrition rate. So they lived 6 years in that intern year, okay? Interestingly enough, University of Michigan freshmen actually had growth in their telomere length. So I don't know what that says about the freshman year at University of Michigan. It's not very stressful. But the interns across the country lived 6 years in their intern year. Diet. Diet is the next thing we're going to talk about, and it's also a very intriguing area, but I would say it's the most controversial. Most people know that exercise can help your health be better, and it can help your cancer health be better. Most people know that sleep can help your health be better. Again, it is your cancer health as well as stress. That's intriguing that it can help your cancer health be better. But diet is the most controversial area, I would say. And one of the reasons that diet is so controversial is because in medicine, we often think of things in terms of machines. So we think, my husband is a total joint surgeon, and so he only does knees and hips. He won't do shoulders. We learn about things as the lungs or the heart or the spine or the thigh muscles, but we don't think they interact because that's just not how we learn about it. But in actuality, we are an ecosystem, right? We are an ecosystem. We're an ocean. So something happens in your pinky finger can affect your skin. It can affect your brain. It can affect your toes. And we don't think about medicine that way. So we are composed of bacteria, virus, and fungi in all organs, and even in our tumors. Our tumors have their own microbiome, okay? We have 40 trillion cells in our body, 100 trillion microbe cells in the human body. So 40 trillion seems like a lot of cells, but we have more than double that of microbiome living in our body. It's kind of gross when you think about it. Microbes are 1 to 3% of our body mass. So in a 200-pound person, that's about 2 to 6 pounds. It's a lot. And the number of genes in all microbes in one person's microbiome is 200 times the number of genes in the human genome. Think about that. 200 times the number of genes that we have in our human genome. So we are, a lot of us as bacteria. And the most important thing about bacteria is that bacterial diversity is everything. Okay? So this was a very elegant study conducted by Gopalakrishnan and published in Science in 2018, where he took humans and took their microbiome, and they were melanoma patients undergoing therapy, and he looked at how diverse their microbiome was. And if they had a very high diversity, meaning all different kinds of bacteria, then their percent progression-free survival was much higher. So they progressed less if they had a diverse microbiome. But then what he did is he took patients and he took their stool and fed it to germ-free mice, because mice will eat anything. And then he injected melanoma in the mice's butt. And you can see that in this picture right here. And then after that, he gave them immunotherapy. And if you look at the graph at the left bottom, the red is the growth of tumors in the mice that got it from non-responders. So if you were a non-responder human, you gave your stool to a mouse who is germ-free, and then you saw how much the tumor grew. The non-responder human stool caused the mouse to have tumor growth and death. The responder, if you were a mouse and you got responder stool, you responded and did not grow your melanoma very much and lived. Very interesting. The only difference in these mice, these were genetically identical mice who were germ-free. They got genetically identical melanoma and they got the same treatment. The only difference was the stool. So, how can we help our stool? How many people think fiber would be good? Or probiotics or antibiotics? Well, we're going to talk about it and we're going to give you some shocking news. This is published in Science in December 24, 2021. I encourage you to read this article. It's a very, very intriguing, interesting article. And in this study, what they did a similar thing to Gopalakrishnan, and as you can see, he's one of the authors on this article. And they gave germ-free mice, they gave germ-free mice stool from a human, and then they gave them a probiotic gavage, which means they fed them probiotics. And again, melanoma and immunotherapy. And as you can see from the bottom chart, the only mouse that didn't have tumor growth were the ones that did not, I will emphasize that, did not receive probiotics. Why is that? Probiotics are the lionfish of our sea. So as you know, lionfish are an intruder that are taking over our seas. They're very strong, they're very aggressive, and they're taking over the coral reefs everywhere. And they're an intrusive species. And that's what probiotics are. They're the strongest bacteria that can live from the factory in California, per se, and come to your Whole Foods, okay? So probiotics are bad for bacterial diversity. Remember, bacterial diversity is everything. Now, what is good for everything? What makes our coral reef? What gives us a coral reef, okay? Well, it's in the same article, I should say, they were mice were injected with tumor cells and given immunotherapy again, but at this time were given a high fiber versus a low fiber diet. And again, the only mice that did not have growth were the high fiber diet and the ones on anti-PD-1 therapy, so on immunotherapy. So you got mice with a high fiber diet receiving immunotherapy were the only mice that did not have tumor growth. And they actually looked at this in a retrospective manner in humans, and humans that got greater than 20 grams a day of fiber had a significant survival probability. okay? And so if you look here, remember we looked back, we're going to go back to that. I told you I'd quiz you on this. But look at the difference here between the sufficient and insufficient fiber. And if you look at the bottom, the p-value is 0.047, so less than 0.05, statistically significant that sufficient fiber is actually has a survival benefit. And if you look at the chart on the right, that's sufficient fiber and no prebiotics. The top line is the red line, again, which is sufficient fiber and no probiotics. So that line versus all the other lines, if you look at B, the p-value is statistically significant at 0.015. So making that sufficient fiber, no probiotics, in patients receiving immunotherapy with melanoma, very, very good response and improvement in survival probability. Okay, so what about antibiotics? Well, antibiotics, I don't have a slide for this, but have been shown a long time. If you're receiving immunotherapy, it really turns off your immune system. And now there's even some data in transplant, bone marrow transplant, and those different settings. So antibiotics bad, probiotics bad, fiber great. If you have a MyFitnessPal on your phone, I encourage you to try greater than 20 or 25 grams of fiber a day. It's very difficult, not from Metamucil, not from processed sources, but from whole food sources. If you're trying to lose a few pounds, this was a study where they took identical twins, and one was obese and one was not, and they fed their stool to the mice, and you can imagine which is the obese twins' stool and which is not. Okay, so very, very interesting study that we're all trying to lose a few pounds around here too. So interesting how stool impacts not just cancer, but really all aspects of our life. And it really is the quarterback of our immune system. And it's interesting to think about it that way, but it really is. So my prescription is to try a completely whole food, high fiber, plant-based diet for 1 month. Okay? Now, what does whole food mean? People always come to me. They get really focused on the plant-based part. But what does whole food mean? Whole food means trying to eat food as least processed as possible, or as much as it looks like when it comes out of the ground. So brown rice is what rice looks like when it comes out of the ground. White rice is not. Flour, it doesn't look like that when it comes out of the ground. So when you take a piece of bread or even a whole wheat bread, those are not what it looks like when it comes out of the ground. An apple is what it looks like when it comes out of the ground. A banana looks like that's what it looks like in the tree. Quinoa is a whole food. So all the nuts, seeds, all these things are whole food. So I would try a whole food, high fiber diet for greater than 20 or 25 grams of fiber. I try 25 grams of fiber for 1 month. And it's going to take a month to see how you feel. Okay, so just the fact that you've listened to me for the last 22 minutes shows that you have optimism. And that's one of the most important aspects of your cancer journey. So they did a study where they took 10,000 people who took the MMPI, which is the Minnesota Multiphasic Personality Index. And 18 years later, 534 of those patients developed lung cancer. The patients were divided into an optimistic group and a pessimistic group. Okay? All right? And what happened is, if you were an optimist 20 years or 18 years before your diagnosis of lung cancer, and I think it's interesting that they called it a non-pessimist and pessimist, but if you were an optimist, it improved median survival by 6 months. And look at the p-value here. We got a 0.01, so very statistically significant. Carboplatin and Alimta, which is a drug we have for lung cancer, improves median survival by 3.4 months versus placebo, and it costs $17,000. Optimism is free. So just the fact that you're willing to be optimistic and go forward and think about your health and make choices to affect your cancer is in itself a survival benefit. So I got to meet Oprah which was awesome, a few years ago. And one of the things that she said was the opposite of love is not hate, it's fear. And I really believe this now. And as you know, remember I started this talk talking about my fears of being an oncologist, my fears of developing cancer when I'm treating cancer patient. And I'm sure all of you have a lot of fear right now with your cancer diagnosis. But I want you to take for 1 minute and think about this lifestyle of exercise, of stress reduction, of eating a whole food plant-based diet as a luxurious lifestyle, not out of fear, okay? So in my mind, the luxury of eating a steak and mashed potatoes, the luxury of drinking alcohol, the luxury of sitting and not exercising and being pampered, and the luxury of, you know, those luxuries are luxuries of the past. Those are very easily obtainable in our society. What is truly luxurious is eating healthy, farm to table, whole foods. What is truly luxurious is being able to exercise every day. What is truly luxurious is going to places that are able to manage your stress and lessen your stress, because we all have stress in our life, right? So when you choose these choices, do not do it out of fear. Let's do it out of love and a feeling that we want to live this luxurious, whole, plentiful lifestyle. Okay? So again, my final recommendations: high fiber, plant-based diet, manage your stress, exercise daily, sleep 8 hours a night. And I'm going to try to do some more video series on each of these individually if you're interested. All right. Thanks a lot. Bye-bye.